Hi, everybody. My name is Tara Leblanc. I am the Medicaid Executive Director for Louisiana. It is my pleasure to be here with everyone this afternoon. So we're going to get started, and as I go through this PowerPoint presentation, if you have questions, you can put them in Q&A or chat. I'm not sure if both of them are enabled. But we can go ahead and move forward. I will describe a little bit about myself. I am in my 50s, so I'll go ahead and say my age to give you an idea, but I have shortish shoulder length brown hair. I have been working for the state for 30 years. My passion is advocacy for our Medicaid members and any other social services that we can provide to our Louisiana constituents. So with that said, I'm going to start sharing my screen from our PowerPoint. Again, if you have any questions and need me to clarify or slow down at any point, just put it in the Q&A or chat and we will do that. Hold on one second. Can you see my slides? Can someone put that in chat to say that they see the slides?
Yeah, Tara, we can see it. Everything's great.
Okay. All right, perfect. Then we are going to get started. And I hope everyone has been aware of what when the public health emergency ended in May of 2023, just a couple of months ago. We have to start redetermining Louisiana Medicaid members to make sure that they're still eligible. At the beginning of the public health emergency, Medicaid had 1.6 million enrollees enrolled receiving their health care coverage through Medicaid. At the end of the public health emergency, we had over 2 million Louisiana residents, adults and children, who get their health insurance coverage through Louisiana Medicaid. Over 90% of that population is enrolled in Medicaid through something that we call managed care organizations. We have 6 managed care organizations for our state. So the next piece of this unwind and for Medicaid is that Louisiana Medicaid eligibility determinations are conducted using automated eligibility rules in our automated system called LAMEDS. And LAMEDS allows for real-time eligibility decisions and greater self-service opportunities for applicants and enrollees. And on the screen, you can see is one of the, just a snapshot of the self-service portal to either log in and apply for Medicaid or ensure that your information is up to date. You can do it online as well as calling, emailing, or mailing information to us. And the next slide discusses the COVID-19 public health emergency. As part of the federal COVID-19 public health emergency, Louisiana had to make a lot of operational changes. Some of that included we cannot disenroll anyone in Medicaid unless they permanently moved out of state, deceased, or voluntarily requested us to withdraw their Medicaid or end their coverage. Outside of that, members throughout this public health emergency, this 3-year time period, remained on Medicaid with no changes to their eligibility. However, with the Consolidated Appropriations Act, which President Biden signed December 28th, 2022, Louisiana Medicaid, like all other states, is returning to our normal operations in Medicaid, which requires us to redetermine every member in Medicaid to ensure that they're eligible. We call that the renewal process for current members on Medicaid. We started our renewal process for the first time at the end of April. The redeterminations for all of our members will be spread over 12 months. If the members' coverage cannot be extended through an ex parte process, or what an ex parte process is that we receive electronic data sources from the federal hub and some state areas. And if we can validate a member's eligibility using those electronic data sources, they actually renew their Medicaid eligibility for the next 12 months and they don't have to do anything. So it's called the ex parte process. And if they're not eligible, or we could not make that determination through the ex parte process, a pre-populated renewal form with the latest information that we found is mailed to the member. And if the member does not respond, they're at risk of losing their coverage, even if they're still eligible. And that's the largest, most stressing item for us at this time is that we have members that we believe that are still currently eligible, but they're losing coverage because they did not respond to the mail that we received, that we provided and they received. Some of our current efforts is CMS requires a good faith effort to reach the member before closing and ending their coverage. We've implemented several outreach efforts to make sure we reach many members as possible. Again, our goal is we want all members who are still eligible to keep their coverage. And our key messages has been update your contact information, including your address, phone number, cell phone number, and email. Read the mail from Medicaid. And lastly, respond to the mail from Medicaid. That's where we need to help with public involvement, is making sure that these members respond to any request for information or the renewal packet from Medicaid. And our Unwind campaign, we have done a lot of outreach. We have 3 primary roles in our outreach, which is sharing information and spreading the awareness about restarting the renewals, aiding and assisting Medicaid members in updating their contact information, as well as completing their renewals. The campaign includes traditional outreach, including media interviews, social media posts, television, radio, digital advertising, and other creative efforts, including we just, we're about to undergo in the month of August, is that information will be printed about Medicaid renewals on the back of a Family Dollar and Dollar General receipt. We have a plan over the next 12 months that will rotate in the state over in targeting more of our rural areas so that we can make sure that we get the word out. Some of our efforts also includes a toolkit online. And I will provide this PowerPoint to be distributed to anyone listening today and for future reference, but our website is healthy.louisiana.gov. And we have the materials in English, Spanish, Vietnamese, and Arabic. Again, it's a toolkit to help anyone that wants to promote the awareness of the Medicaid redetermination unwind process. And another effort we've done is we have taken the state, every parish, and we have engaged partners from grassroots organizations that are going out doing neighborhood canvassing. They're hosting and attending community events. They're using phone banks. They're covering at sports events and festivals. They're outreaching to faith-based leaders. So every parish in the state has been assigned a grassroots organization, and those organizations are reaching out to members any way, shape, or form. If you have any other ideas about where we can target our outreach, we really do recommend you guys sending in some recommendations to us so that we can ensure that we're getting to all of our members. And our partners, just for everyone to understand, includes universities, Grambling and Southern, La Louisiane, the Louisiana Primary Healthcare Associations, which is mainly our FQHCs, our Rural Health Coalition, our North Louisiana Interface, People Care, which is the independent pharmacies, Southeast and Southwest area health education centers, the Medina Group, and East Baton Rouge Parish Council on Aging, and some of the organizations that we've listed, such as the Louisiana Primary Care Association, as well as the independent pharmacies. They've actually hired navigators to be in some of their pharmacies or some of their offices and clinics to actually help members understand the renewal process and help them guide them through what it takes to respond to Medicaid. We also, our 6 MCOs, I do want to say, I want to commend our MCOs. They've done a great outreach effort where we've been collaborating with them for over a year now. They are supporting us with return mail. They have done huge pushes to update the contact information, and they've really have worked with us with getting in contact with their enrollees when their month is up for renewal. Before I go to the next slide, I do want to discuss a few things. What we are doing with all of the MCOs and all of our contracting partners is that we send them, when the individual is up for renewal, we send them a file that says, hey, these members are up for August. And then 30 days after we mail that renewal, we send them another list. It's targeted to say, these people have not responded after the first 30 days and they're at most risk of losing their Medicaid. So they all do targeted outreach to these members. So we have been doing a lot of outreach. We text, we email, we call, we're doing any form of outreach we can to get to our members to make sure that they understand the importance of them replying to that renewal packet they received from Medicaid. One thing that we can say we have been successful with is updating the contact information. We have only of the first month that we did renewals, which ran the last weekend of April, which was for the month of June. We only had about 8,000 return mail, which is just astronomically superb for Medicaid. That indicates that we've updated a lot of the contact information, but for some reason the members did not respond. So when I say that we've been successful on that, we still have not been successful for getting all the membership to respond to the renewal packet. This slide shows you we mailed out the last weekend of April, the first week of May, anyone that's their renewal packet for the month of June. The total beneficiaries who we initiated renewal in June was 151,000. The number of beneficiaries who we renewed was 91,000, either by that electronic ex-parte process or those members responded. We had determined almost 13,000 to be ineligible. They responded and we agreed that they were ineligible. However, this is the one that's a very hard pill to swallow. We closed almost 38,000 individuals effective July 1st for failure to respond to our renewal packet. These numbers will mimic the same for July. We'll have those numbers around the end of the first week of August for July. And sad to say, we have increased our outreach, more targeted to those members, but the numbers today still do not look much better than what we had for the month of June. So the reason that I am trying to share this information with everyone on the webinar today, it is the utmost important that Medicaid members, not only do they receive that letter from Medicaid, but they respond. And again, they can respond by calling emailing, mailing, going into one of our 11 regional offices. And, you know, they're losing their coverage. Now, I want to say we are expecting a lot of churn, and churn is basically members that close, like this group, for failure to respond. They either go to receive a service such as the pharmacy to get their meds filled, or to a physician's office to get some type of service, and they realize their Medicaid is ended. If they call back within 90 days of their termination, we can retro them back 90 days. So it's important that they call back, and then they won't have a lapse in coverage. If it's after 90 days, they have to reapply. So we do expect a lot of this 38,000 individuals to come back on. Now, we do think some of them will be ineligible, but we do think a lot of them are still eligible and will come back on at some point. It's just at what point that will be, no one has that crystal ball to be able to predict when they'll come back on the rolls. So that's really the information that I wanted to share today. The main thing is watch your mail and respond to anything that Medicaid has mailed to you. So I see there's a lot of questions in chat, so I'm going to stop sharing my screen, and I think we can just start answering the Q&A. I am going to, I'm going to start with the.
You want me to read them, Tara, and you can,
yeah,
you and the staff can
go for
answer?
it. Yeah.
Okay, so this first one, I wanted to jump in and answer myself, and then I was like, wait, maybe I don't know the answer, maybe I don't understand it. So what they're saying is Medicaid available for children who have Medicare with a disability, and should we apply?
Yeah, so anyone that they believe that if they feel that they are Medicaid eligible can apply. And yes, we do have what we call dual benefits with Medicare and Medicaid. So yes, to that answer is please do apply.
And Tara, just a little bit further in that, if a child was deemed eligible for Medicare, I mean for Social Security disability, that's what I assume this is, they would likely be eligible for TEFRA Medicaid, as well as maybe Medicaid financially.
Yes, baby, I was going to not go into a lot of detail because there's so many cases where that child may be eligible for different levels of service. Because if they have Medicare, they can also get where Medicaid picks up the premiums and the copays. Or they can do TEFRA. They may be eligible for waiver services outside of the TEFRA program. So I think they just need to either call Medicaid or apply completely to see what's available to them in their situation.
Right. Now we have someone asking that someone renewed 1 week prior to the case closure, and however, he was informed the case is closed. What do you suggest?
He needs to call the Medicaid hotline number and let them know that he did reply before. I think that's just the timing issue, Bambi, of when we have to run the job with the closure and when it was received in the mail. So they could call back, and that's what would be considered churn for me. They would retro back. If that individual is still eligible, they would retro it back to his date of closure.
Okay, and we also have someone who, it looks like maybe they renewed with their primary care doctor, or maybe through their office. And then we have someone asking, is there an organization working specifically with individuals with disabilities in regards to, I guess,
there is. Well, so there is not an organization working just with disabilities, but I will say that if the person has received home and community-based services and waivers through the Office of OCDD, Citizens with Develop, I always say it wrong, Office for Citizens with Developmental Disabilities, and Office of Aging and Adult Services. Both of those offices, we are working with our support coordinators and case managers. They also receive the file who was up, and they're trying to reach out to them. But outside of that, we don't have any targeted areas to those with disabilities. However, I will say the grassroots organizations such as the AHEX are very well experienced with working with the ones with disabilities. So they are doing a lot of outreach and trying to assist with that if they can be identified as someone with a disability.
Tara, I don't see any other questions, but just to piggyback on what you said, my son has a waiver, and I know his support coordinator reached out and reminded me whenever it was time to renew, which was June 30th. And I was a bit confused about the whole process because it was a little bit different, hadn't done it in years because of the pandemic. So it really was, even for me, a little bit like, am I supposed to do this? Or are they just sending this to me? And we really don't, we just have to ignore it. And so I'm glad the support coordinator just continued to follow up, and we did get it in time.
Yes. So we are working with them each month doing that. So is there any other questions?
Can people know when their renewal is due? Is another question.
So not really. At this point, because of the pandemic and we had to stop everything, and with CMS regulations, we basically had to divide the population by 12, and there were some guidelines about who could move months and who couldn't. So we just kind of had to shuffle people and to make our distribution evenly. So not everyone, just because prior to the pandemic you were the month of February, does not mean that February is your month. I know that is one thing we've been struggling with, and that's why we are expending so much time, effort, and resources on the outreach and doing all of this community work, is to make sure that we get to everyone. And you know, I'm hoping everyone is seeing our billboards and they're seeing our television commercials, and you know, somewhere in the community that they need to be monitoring their mail.
So we have another comment that a healthcare navigator in a meet was very helpful in reassuring me that my daughter was still eligible, since marketing efforts have been very effective. Thankful for the call to Vicky.
Okay, that is great to hear. Thank you. Thank you. We are hearing trickling stories of our outreach efforts are being successful. So that is what we need to hear. And if they're not being successful, we also need to hear that and need to know where we can strengthen. And that's where I'm asking, if anyone has recommendations, they are more than welcome to send them to Medicaid or myself, so that we can make sure that we don't miss anyone. Our goal at the end of the day is to ensure that everyone that's eligible for Medicaid receives their Medicaid healthcare insurance coverage.
I see Liam has a hand raised.
Yeah, so just very quickly, Tara, I'm a Medicaid recipient myself. If I need to double check and make sure that I'm, if I need to reevaluate or reapply, is it better to reach out to the state Medicaid, or should I look to the region of where I'm at? And is it better to, you know, is it better to go locally, or should I go more of a statewide reach out?
So, yeah, you could either email Medicaid or call Medicaid.
Okay.
Charlene, can you put the numbers and the email in the chat for people to see, please? Not in chat, Q&A.
Sure, I'll get it.
Yep. All right. So Liam, I email would be the best. Our phone, we are doing such a great job of outreaching. We're being inundated with phone calls. So I don't want to sit here and say that you're going to have a quick phone call if you go call. But we are getting quicker response on email, just because we can work in the evenings and on the weekends to help respond. I just had a conversation with CMS about our outreach effort has been wonderful. But yet now our call center matrix doesn't look so pretty these days. But that's just because we are getting so much information out in the communities. Everyone's calling to make sure that they're not missing their time frame. And so a lot of people are getting are aware, because we can identify when their renewal month is when they call in, but we just have no way of just telling everybody it at one time. So I think Charlene was putting in the chat. Yep, wait, Bambi, can you copy and paste that? Let me see if I can copy and paste that.
That's okay. I can put it.
You can put it in the chat. Okay.
I did.
Oh, we are trying to get you guys. We have it in Q&A, not in chat. We're trying to get it. Charlene is typing it again. Let's see if it's working.
Didn't show up.
Oh, I just put it in chat and everyone can see it. I'm sorry, I
Okay.
didn't realize I was on mute. I'm starting.
Okay.
I see Demetria has a hand raised. You can put your question in Q&A really quickly, and we'll, if you have that, well, and anybody else who has a question, we'll give you just a few seconds to get that in there, and otherwise we will wrap it up. That could just be an accidental hand raise. Okay. Let's see, any other questions? So I guess we'll go ahead and close. But Tara, but before I see, it sounds like we have someone talking. Okay, sorry about that. Okay. Oh, we have some Q&As. Is renewal date and case notes online reliable? Tara? Are you there, Tara? I'm not sure what happened to Tara.
It seems as if she
Are you there, Tara? Maybe we lost her.
I think we lost her, Bambi. I don't see her.
Okay. Maybe one of her, oh wait, here's another hand. Okay. Jamie, you want to answer this question? Is the renewal date and case notes online reliable?
It is reliable if they're looking at the SSP, at the online portal. So if they go to the self-service portal,
Mm-hmm.
and if their account is linked with their case, then they can also see correspondence that's been mailed out to them.
Okay. Yeah, I think that answers it. And Tara, I see your hand raised. I think you can turn on your video again.
Hey, Bambi, this is Tara. Can you hear me?
Uh-huh.
Okay, I'm sorry, I lost video, but my computer froze up, so I'm just on my phone. I'm so sorry.
Okay.
right.
Well, I think we're at the end. One more question. Do we actually have to renew if we use Medicaid often, or do I just renew and stay current because you go back and forth to the doctors?
You are required to renew every 12 months, so every year. So yes, you have to renew when you receive something from Medicaid.
Okay, thank you. And I think that's it. But Tara, before wrapping up today, I wish you had video, but that's okay. I hope you can see, or you can at least hear. I just wanted to thank you for your service to the state of Louisiana. I know that you will be retiring soon. Oh, I see you. You'll be retiring soon, and I know that you have had really jobs that just such magnitude and importance in the state, and I've known you for many years, and I know that there's a lot of challenges in the work that you're doing in Medicaid or the Office of Aging and Adult Services, but one thing that I know that I've experienced, and I think that other advocates will attest, is that you've always been an advocate for the people and making sure people had the services that they needed, even though there was pressure, there's political pressure, there's administrative pressure. You always were very focused on making sure people had what they needed. So just wanted to to take this opportunity to thank you for that and enjoy your retirement. For as
Thank
long as it
you.
lasts.
Yes, Bambi, thank you so much for that. And for everyone that's on, I am retiring September 30th. I already currently have my 30 years in with the state. But I am not moving away from healthcare and advocacy. I really don't know what I'm going to do after I retire, but I am going to still participate in some form of advocacy in the healthcare arena, especially in the Medicaid and Medicare world. So I appreciate the comments. And now it's been getting emotional for me because it's getting closer. I don't know what I'm going to do when I wake up October 1st and I have nothing to do with Medicaid, but I'll still be around.
We're good. Well, congratulations and good luck, and we appreciate you.
All right. Thank you so much.
Thank you. So this concludes the conference for today, day 3. Tomorrow is our last day. We'll be here from 9 to 4 tomorrow. And we're looking forward to seeing all of you guys on our last day. Thank you. Have a good evening.